What he misses most are the simple things, like going on a walk with his dad. 12-year-old Denaz lost both of his parents to COVID-19. His uncle joins him to pay tribute at the family grave. Denaz is one of around 15,000 children in Indonesia orphaned by the pandemic. So far, more than 140,000 Indonesians have died since the start of the pandemic, two-thirds of them between June and October 2021 alone. And the second deadly wave is still raging, claiming more and more lives, leaving loved ones behind to mourn. Welcome to our COVID-19 special. I'm Monica Jones. Good to have you with us. In early summer, Indonesia became the global epicenter of the coronavirus pandemic. On the island of Java, volunteers help bury the dead.
Antonius Harjano puts his life on the line, caring for the dead. The 53-year-old is a member of a so-called quick burial team, one of the many COVID-19 volunteer groups in the city of Yogyakarta. Their motto is, People of Johor district, we are responsive, agile and tough. The volunteers help overwhelmed cemetery officials to deal with the many COVID-19 victims in Indonesia. Despite much lower case numbers in recent weeks, their help in this part of Java is still needed.
I am suffering from all the heat and all the sweat. Sometimes the funerals process is entirely in our hands because the others are afraid.
It's not just that some people are afraid. Many grave diggers are simply exhausted and can no longer, for instance, collect bodies from people's homes. During the peak of the pandemic, graveyards were open around the clock. In July alone, 570 people died here, more than in the previous 12 months. Normally, Harjano works as a cleaner, but in the pandemic, people like him have prevented the entire system from collapsing. His family is proud that he volunteers, but they also fear he might get infected.
If he gets infected, he will have to quarantine, and that leaves me, a self-employed housewife, all by myself. We will run out of money, and it's only me looking after our children.
The volunteers hope that the fast burial of bodies will not only bring down the infection risk, enhance the mortality rate, but also help to reduce the psychological burden for mourning families. Harjano is a Christian and says he regards helping as a duty.
Is it a risk? Yes. We're actually a little afraid, but we throw that fear away and put our hope in the Almighty. It's great to help people in need and make sure things run smoothly and safely.
And with all the precautions in place, Harjano is positive that he can achieve this goal at the end of the day with a negative result.
For more, I'm joined now by Makian Jibril from the East Java COVID-19 Task Force in Surabaya and Ahmad Utomo, a molecular biological consultant and lecturer at the University Yarsi in Jakarta. Good to have you both with us. I would like to start with you, Makian, because as a member of the COVID-19 Task Force, what do you do to keep the virus under control?
Yeah, well, basically we are surprised because in the June and the July, the cases of COVID-19 in Indonesia are spiking very high suddenly. So in only around 3 weeks, our hospital's occupancy rate from around 20% occupied to about 80%. So basically we are surprised first. However, we do realize that to make sure that the spread of COVID-19 can be controlled, we need to believe and apply science and also the recommendation from WHO. We need to make sure that we have enough capacity of testing so we can achieve the positive rate of below 5%. We also need to make sure that the tracing ratio also more than 30 per each cases that we found. And of course, we need to make sure that we have sufficient hospital capacity. And of course, we need to collaborate because yeah, we have a very complex government, and also we have a lot of things to collaborate. If we are working alone without collaborating with the people, without collaborating with the military and the police, we might not be able to achieve that.
Right. It's interesting that you say you are surprised by that surge. Ahmad, perhaps you can shed light on it. What triggered this surge in June, I think it started?
Well, it could be two factors, the virus factor and also the human factor. We know the virus is like a sport car. It's a next generation sport car. But as good as a sport car, it cannot run in a very bad road, right? So we know before the surge, the social movement is not that restricted. And then the people contact is very close. It's very difficult to control. So I guess the virus can spread quite easily, especially when the virus has easier a way of transmission. Now, the question is, in Indonesia, what we have problem is when it comes to the human one is the poor quarantine policy, and especially to the foreign travelers. And also the contact tracing is also not that good. So when Dr. Mahian mentioned that we should have at least 30 people for every one case, that's not really being done. So that could be a problem we cannot really mitigate as quickly as possible. So
Right.
that is actually the one we have to keep in mind when it comes to controlling this pandemic.
Okay, and Ahmad, about this report with volunteers helping undertakers bury the dead, how risky is that? How risky is it to actually get infected?
Right. When it comes to the dead, of course, the one in close contact, especially the undertakers, that clearly is actually posing a great risk. So certainly we appreciate what they have done. However, we have to also keep in mind that when this burial control has to be in isolation, what we want to prevent is the crowd, because the general rituals of the burying of the dead involving so many people coming to the houses and also to the cemetery. So at least that part is mitigated, but certainly for those people, those undertakers, that clearly is posing some risk to their family as well. But I noticed that they have been wearing a good protective clothing, so that should actually minimize the risk.
All right, that's good to know. Makian, on the upside, I mean, statistics suggest that the infection rate across Indonesia could actually have peaked, so things could get better. How hopeful are you, because you're working on the ground, that this wave could soon be under control?
Yeah, basically we can see that at June or July, the daily cases of COVID-19 in Indonesia are very high. Even they reach more than 40,000 cases per day and more than thousands of deaths per day. But now we can see that the trends are declining around 80 until 90%. So we believe that there is a positive sign that probably the pandemic in Indonesia in the right way to be controlled. And also we can see that the vaccination rate was quite satisfying, because we have 105 million of Indonesian citizens who are vaccinated the first dose, or similar with 50%, and 29.4% of Indonesians are already vaccinated. So hopefully the combination between the good testing and tracing and also treatment with the vaccination and also the social restrictive movement, because we already pulled the emergency bridges, which led by our Ministry of
so things,
Maritime.
Things are looking up, I take it. And that's also good to know. Maki and Jibril from the East Java COVID-19 Task Force and Ahmad Utomo from the Universitas Yarsi in Jakarta. Thank you so much.
Thank you very much. You're welcome.
Thank you.
Time for one of your questions now. Over to Derek.
Will COVID-19 become endemic with seasonal surges?
Let's start by clarifying the difference between pandemic COVID-19, which is what we're facing now, and endemic COVID-19, which is what most public health experts now believe we'll face in the future. A pandemic is when an infectious disease moves beyond local and regional boundaries and affects people on a wide scale, usually worldwide, with unpredictable fluctuations. The term endemic disease describes a background disease that's relatively constant in a population over time, or at least constant enough that we can predict patterns of transmission with some accuracy. The bugs that cause colds or seasonal flu are endemic, for instance. They're always there, but we know, for example, that they'll generally affect more people in the wintertime, and we can forecast broadly how many. And that knowledge helps make them manageable. But it's still impossible at this point to guess exactly how long it'll take for COVID-19 to reach that status, many experts say, because that depends on a host of factors. First and foremost, how widespread immunity becomes worldwide. That will depend heavily on vaccine take-up everywhere, as well as the still open question of how long-lived protection from vaccines proves to be. Because vaccine distribution and take-up is still so different from country to country, researchers say COVID-19 numbers won't stabilize at the same time everywhere. But once it's infected most of those who are unprotected and survivors have at least some level of immune protection, the general expectation is that, like other infectious respiratory diseases, COVID-19 will begin to affect more predictable numbers of people every year. We'll learn to live with it, and the pandemic will end. SARS-CoV-2 will be endemic, and because we know transmission is most likely indoors, that'll probably lead to seasonal surges as well.